Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews here in the studio today with Maynard Nexon healthcare attorney Matthew Roberts. Matthew, good to be with you.
Good to see you.
And we are delighted to have an in-studio guest today. Joining us is Dr. Edward Simmer, Interim Agency Director for the South Carolina Department of Public Health. Dr. Simmer took over as director of the agency, formerly known as DHEC, in February of 2021, and you've led that agency through the latter half of the COVID-19 pandemic and through its split by the state legislature into two separate agencies, the Department of Public Health and the South Carolina Department of Environmental Services. Prior to joining state government, you retired as a captain following a 30-year career as a United States naval officer. Thank you for your service.
Thank you.
And thank you for joining us today. We're excited to have you with us in person and to hear more about the Department of Public Health.
Great. Well, thank you for having me.
Well, I'll start us off. Thanks again for joining us. One of the things I've heard you mention recently are the improvement in the rankings for the state for public health, which is the first time in a while that they've improved the way that they have. Can you talk a little bit about that?
I'd be happy to. So it's something called America's Health Rankings. It's been done since 1990, and they look at a whole variety of different health outcomes for each state across the nation. And unfortunately, since 1990 until last year, South Carolina was always in the bottom 10. So 42, 45, not where we want to be, obviously.
Right.
But we were one of the least healthy states in the nation, the way they measure that. Last year, we were 39th. This year, we are now 37th. Now, clearly, 37th is not where we want to be, right? We want to be the healthiest state in the nation, and that is our goal. But we are making progress. We're moving in the right direction. I think, that's thanks to the work that we're doing with a lot of different groups. It's certainly a team effort to move us and continue moving us in that direction going forward. But I think we've seen improvements in a number of the health metrics that they measure, everything from some of the chronic disease elements to life expectancy in South Carolina. So I'm encouraged by what we're seeing. Again, there's a lot more work to do, but that's a nationwide respected ranking service that I think is showing that we are making progress.
It's hard to believe that it's been 5 years since the pandemic first hit. And I know you didn't come to South Carolina and join state government until we were well into it in 2021. But could you first tell us what, as an industry, public health has learned post-pandemic? Sure. And then also, now what are the issues that you're focused on?
Sure. I think the number one thing that we've learned from the pandemic, and we've learned a great deal, we know far more now than we did even when I started in 2021, is that we need to listen more. I think that's the number one key thing, is that we need to listen to the people of South Carolina. We need to listen to the people that we serve. Sometimes I think in the past, public health has gone out and said, we've got a solution, and here's the problem we think you have. We need to listen to our communities and see what are the problems that they see, what are their concerns, and then try to help them address those challenges. So as part of that, one of the things that we're doing is we're doing outreach to every faith-based group in the state, every community organization in the state, and that's thousands of groups, but asking those very questions. And then we try to link them with resources either from our agency or often from someone else in the community that has resources to help them address those challenges. So I think what we've learned from the pandemic, number one, first and foremost, is that we have to rebuild trust, and we do that through listening. I think in terms of the number one public health issue I'm most focused on right now in South Carolina is childhood obesity. I think we have a very serious problem with childhood obesity, especially in the state. That's not unique to South Carolina. Most southern states have that. But childhood obesity brings all sorts of problems. I mean, as a child, that child is often not as physically fit. They may be teased and bullied in school because of their weight. And it has an emotional toll as well as a physical toll. And unfortunately, obese children tend to become obese adults. And we know all the problems that obesity brings in adulthood: diabetes, high blood pressure, all those sorts of things. So I think if we can combat childhood obesity, and I think we can, and I think we are starting to make progress, that's something where we can really improve the health of people, not just now, but for many years to come. The other thing I would note about childhood obesity, as you said, I was in the Navy for 30 years. Obesity is one of the top reasons people are not qualified to join our military. We need more good people to join our military. And so combating obesity will actually help with military readiness as well.
Great. You've mentioned maternal and infant mortality as being a focus area for the agency. And can you talk a little bit about some of the steps you're taking to address these important issues?
Yes. As you said, we are one of the worst states for maternal and infant mortality, unfortunately. Very, very tragic issue. Right now, and there's very significant disparities. If you're a mom in a rural area, you're twice as likely to die either while you're pregnant or during the first year after the child's birth, which is how we define maternal mortality. Twice as likely as someone in an urban area. African American moms are 4 times as likely to die as white or Hispanic moms. So we have serious problems in the state. And we want to help every mom and every baby have a healthy future. So several things that we're doing. One is that we have 15 counties in this state with no OBGYNs. We have another 5 with only 1. So a big problem is lack of access to good prenatal care. And if you don't have good prenatal care, you're less likely to have good outcomes. So that's a big issue for us. A lot of people have tried a lot of things to try to correct that. It's hard to get OBGYNs to go into some of our more rural counties. So we got funding from the legislature last year for a mobile maternity unit. It's actually basically a maternity clinic on wheels. It has an ultrasound. It's going to have an OB, a doula, hopefully a lactation consultant, an OB nurse, and it will go out into these areas where there is no OBs and provide pre and postnatal care, which is so desperately needed. Because we have counties in this state right now where less than half the moms get adequate prenatal care. So that's one thing that we're doing, is we're bringing care to where it's needed. Another issue that's very important is making sure that pregnant women, new moms, and their babies have good nutrition. So our agency runs the Women's, Infants, and Children's Nutrition Program, which provides nutritional benefits, education, breastfeeding support, all the things that new moms and their babies need to be well nourished. And for the first time in a long time, we are now over 100,000 women and children in that program. More than 53% of those eligible statewide are now signed up for the program. We've been working really hard to get the word out and encourage people who are eligible to sign up. And the other big point with that is now we've also expanded that benefit into many farmers markets. So the mom can go to a farmer's market, use her benefit there. That helps, obviously, the mom and the baby, but it also helps our farmers. It's also good because we have a lot of areas where we don't have grocery stores. We have, the so-called food deserts. But in many of those places, there are farmers markets. Because that's a little bit easier to set up. It's 1 day a week. So that gives the mom and the baby access to nutritious food that they wouldn't have otherwise. So that's just a couple of the things that we're doing with regards to that. Another thing that we're doing is we have a program on don't leave your child in the car, on a hot day, and also safe sleep. Because tragically, last year we have data for 25 infants died in this state because of suffocation in bed. And that is absolutely preventable. The baby should not have a pillow, should not have a blanket. They should be in just a mattress with a cover, a safe crib, which means relatively newly made. And if we can do that right there, we would have saved 25 babies. And again, then, we actually give things out that goes around the mom's wrist, or dad, or whoever's got the baby, to remind them, don't leave the child in the car. Right? Because it's easy to forget sometimes. You're in a hurry, you're rushing somewhere, baby's in the back, maybe sleeping, and you just forget. And so we're trying to help make that sort of thing less likely to happen. So there's just a few things we're doing.
So those are great examples of how the agency is collaborating with healthcare providers and not just regulating them.
Of course.
So can you talk a little bit about how that collaboration really works toward meeting your agency purpose?
Yes, absolutely. As I said at the beginning, nothing we do is DPH alone. Right? We work with hundreds, thousands of partners all across our great state, and we have to, right? So we work with doctors, nurses, community groups, faith-based groups. For example, we have a group of faith-based organizations up in the upstate where we've given them blood pressure cuffs and trained, maybe there's a nurse, in the congregation or that, and we've trained them how to use them and what to do if they find someone whose blood pressure is high. And what we're getting the feedback is they're finding a lot of folks whose blood pressure was high and never knew it. Right? And if you treat high blood pressure early, you can avoid the bad things that come with it, like heart attacks and strokes. So that's just one example where we're working with many groups across the state, doing a lot of collaboration. Another thing that we've just started now is because we do license healthcare facilities and we inspect healthcare facilities. It's our responsibility to make sure that healthcare facilities across the state are safe and provide high quality care. But, we don't want to just go in and be the bad guy. Right? That doesn't really help anybody. So we've now set up collaboration teams that go in before an inspection and they'll help that facility, identify, hey, these are some challenges we're having. And it's safe because it's not an inspection. They're not going to fail. But the facility can say, these are concerns that we have or something that we're having a problem with. And we can look and see if there's problems and help them solve those problems before the inspectors come. They can bring in best practices from other facilities. And we're finding that's very popular with our facilities, and it's improving the quality of care.
And DPH, as I understand it, is over regulating and licensing of all kinds of healthcare providers. So everything from like a hospital to a nursing home.
Yes.
That pre-scheduled planning, I'm sure, is one improvement. Are there other collaboration projects that you can work on together where it's not you're just going in to issue a fine, but actually helping to build up?
So two things. One is that we are going to be posting all inspections and complaints online. Right now it's very difficult. You can write us and ask for a copy of the report and we'll send it to you, but that takes time. It's a lot of work. So we are working on setting it up on our website, dph.sc.gov. This will be coming out in the next few months, so it's not quite there yet, but it's coming out in the next few months where every inspection for every healthcare facility we license, every complaint we've processed will be there. So if you're looking for a facility to place your mom or dad in or someone, that you can immediately go out there and see what has an impartial party thought about this facility and how does it look.
That's good. That's a good example. Shifting to behavioral health, we know that that's an issue for the country and that we know that there's a massive need. What is the agency doing to try to address that need? You're a psychiatrist, so you understand this better than most. And what are some examples of what we can do as a state to try to work on that?
Well, I think, first of all, we need to make sure there's great access to care. And we need to focus more on prevention. And obviously, we work with others all across the state. Department of Mental Health, of course, Department of Alcohol and Other Drug Abuse Services, because mental health and substance use issues often go hand in hand, and we need to treat both. Working with the Department of Education, because schools have a big role to play in child mental health. So I think, and also then the Department of Health and Human Services, who runs our Medicaid program, and also provides a great deal of funding for mental health across the state. So we're working with them, with private groups, to identify where are the needs, where are the gaps in our system, and then trying to improve those. So, for example, we are working with the Department of Health and Human Services, who's leading a project to build a comprehensive mental health campus in Florence, which I think is going to be a big plus for us. They'll have inpatient beds, but they'll have residential treatment. They're also working with some of the schools in the Florence area, because one of the things we know about mental health is that prevention is key, right? And if you can solve a problem early, help a person when it's manageable, it won't get to the point where it's not so manageable anymore. And so, I think focusing on prevention, one of the things I think Health and Human Services has done really well is expand the child counseling services in our schools. They bring mental health counselors in. They're now all certified, which I think is very important. And that's where, the teachers see those kids a lot. They know when there's a problem. And if they have someone they can easily refer that child to, talk to the parents, say, hey, do you mind if this person sees the counselor, this child? That can make a big difference. I think another big piece of mental health is going beyond just traditional mental health treatment. A good bit of mental health is the environment you live in. And so, does the person have a safe place they can go and exercise? Do they have access, like we talked about, to healthy, nutritious food? Do they have social connections? Do they have friends? Are there, if they're maybe older, is there a senior center they can go to and engage with other people? Those kinds of things make a big difference in mental health. We don't think of them as traditional mental health treatment. But when you do things like making sure they have transportation, healthy food, people they can interact with and communicate with and connect with, that can avoid so many more serious mental health problems that are much harder to take care of later.
I have sure seen the impact of a senior center avoiding isolation.
Yes.
For those who are on their own now. One thing I've learned since doing 200 plus episodes of this podcast with Matthew and surviving COVID is that public health covers so much.
Yes.
If you can, just cast a vision for us on where you see the future overall for our state with public health, and then maybe how if somebody should ask, like, why should I care about that, if you could help explain why it is important.
Sure. Well, I think I see the vision of our agency as bringing people together. Our vision officially is healthy people living in healthy communities, and that's what we're working towards. But that means the community has to be working together. So again, I really think our job is to be the convener. We identify where there's challenges, working with the very groups I talked about. And then we bring resources to those challenges, often in the same community. So I really see us as bringing people together, working together on the issues of health across our state. For example, we're about to release the State Health Improvement Plan. It's a guide to how we want to get to be the healthiest state in the nation. And that's had over 60 stakeholder groups working on it and writing it in tandem. And I think that's the kind of thing that we need to see if we're going to become the healthiest state in the nation, is everyone working together. Now, we may not always agree, and that's okay. But I think so long as we all share that same vision, and I think we do, then we're going to get there. And I'm convinced of that. So that's where I see our agency going, is really being the convener. Certainly, as I mentioned, we want to do more in terms of the collaboration with healthcare facilities, more bringing people together. The other thing that I'm working on is, especially in a time of, when the federal budget is declining, or getting a little bit less funding there perhaps, is identifying what are the core functions of the Department of Public Health. What do we have to do for the state? Some of those things are, we run the public health lab. We take care of rabies in the state. Those are the kinds of things that we have to do. And we need to make sure that we put our resources and our energy towards those things, because my goal is to be the best in the nation at having a public health lab. And as you may know, we're building a brand new one. And I think it is going to be world-class and best in the nation. We need to be best in the nation at making sure that every animal that looks suspicious for rabies gets tested. And if there's a human contact, we get those folks help right away. We need to be best in the nation at doing newborn testing. We've tested over 240,000 newborns for genetic diseases that are not apparent at birth, but if you don't treat them right away, can have long-term devastating consequences, even kill the baby. And we've had more than 1,000 cases now where we've identified that, and intervention has saved that baby's life. So I think those are the kinds of things that DPH has to do, and where I want to focus. So again, bringing people together, collaborating with those that we license, and really focusing on what is our core mission, and let's put all of our resources and energy towards that.
Well, you definitely have a full plate, and I'm grateful for the work that you've been doing in our state since 2021. On behalf of Matthew and our whole crew here at Taking the Pulse, Dr. Simmer, thank you so much for joining us. Wish you the best in the future.
Thank you for having me. I've enjoyed it.
And for those of you who joined our conversation today, we hope you learned a little bit more about the Department of Public Health in South Carolina. We look forward to seeing you next time right here on Taking the Pulse, a healthcare and life sciences video podcast.